overcoming saber-toothed tigers and woolly mammoths, we must now face a new enemy, ourselves. With the rates of diseases such as heart disease, stroke, diabetes, depression, and many others ballooning, we must find a better solution to these modern epidemics. Welcome to the Preventive Medicine Podcast. We believe in building a foundation of health by means of prevention so that you can build the life you want and find fulfillment with no barriers. Hear from experts around the country on how to take your health into your hands. Take control and build a foundation of health for the life that you want to live. And now here's your hosts, Jason Garrett and Ragav Sharma. All right, guys, we are live with the Preventive Medicine Podcast. We're doing a unique episode here. We figured Jason and I here could just sit down and chat with y'all a little bit more about the background of the podcast, how we met, and kind of why we're deciding to take on this project and what we hope to achieve with it. So there's nothing scripted here. We're just talking from the bottom of our hearts right here. So, yeah.
Straight from the heart to your ears.
All right, so I'll get started. Jason, tell me a little bit about your background and like how you came to appreciate preventive medicine, why you're involved in this project.
Okay. So for me, it's kind of a journey of a process. I didn't know I wanted to go to medical school until a little bit later in life. In high school, I played sports. I played hockey growing up, played baseball, played basketball. But in high school, I also started getting kind of fat, to be honest.
Just in high school? Why'd you start getting fat in high school? Most people like either start fat and like stay there or like...
So I was definitely a chubby kid. Of all my family members, I was like the chubby one, you know? But then I grew tall. So I basically grew to 6'2" when I was in the 8th grade.
So it leveled out.
It leveled out. But then my eating caught back up with my height, my growth. So like by the end of my junior year, I think I was almost 260 pounds. And one day I was literally just getting in my car and I put on the seatbelt and it was so tight that I like that was my moment of like, I got to do something about this.
I know exactly how you feel with that. I was also 260 pounds, except I'm not 6'2". We'll get into my story later. I was like 5'8" at that weight, but.
So at that point, I had already been lifting weights. I didn't know anything about lifting weights, but, just whatever the basketball team was doing or, whatever I was reading on the internet at that time. But at that time, I really decided to clean up my diet. And again, at that time, knew absolutely nothing about the diet, was very reductionist in my mindset of healthy foods, good foods, bad foods, and tried to cut out the quote unquote junk food from my diet. And it worked. I lost about 60 pounds over the next year. And then that kind of pushed me into wanting to learn about exercise, wanting to learn about nutrition. So in college, I actually went on to major in nutrition with a minor in biology with a heavy emphasis on exercise science classes. Fast forward to senior year, I'm in my last semester. I'm taking an advanced exercise physiology course, and the course professor was an MD, PhD. So super small class, super awesome discussions. And he actually had convinced me through our discussions to either pursue an MD or a DO, basically letting me know like, hey, if you want to do exercise research, you could do that as a physician, but your reach will be limited in these other fields if you don't become a physician. So decided to do that. Ended up going to Northwestern University, getting my post-bac certificate with all my pre-med courses, applied to medical school, and now here we are.
When it came to making your impact, I guess, from that scale, did your professor like see that you wanted to make an impact on a larger scale, or how did he know that you wanted to have that large impact, and why did he encourage you to go to med school for that?
I think it was just so, and I wish I could remember the exact discussion where we kind of came to that point, but we had been talking about research. So I had been talking to him about possibly pursuing a research project with him. And he was wondering, at that point, I think he was wondering what my plans were. At the time, my plans were to either go on and get my PhD in nutrition or get my PhD in exercise science. So I kind of just wanted to get my feet wet with research and see what that life was about. And somewhere along in lines in that conversation, he had convinced me to go the medical school route. And also at that time, so during college, I had worked at a Lifetime Fitness, just doing front desk customer services stuff. During that time, I actually got certified as a CrossFit trainer and began working for a CrossFit gym up here in Illinois. And so I'd done that for about 4 years by that point as well. And we had kind of talked about the differences between working like with the front lines, so to speak, of the fitness world versus the research versus physicians. And so this kind of the idea of what we're working on now has kind of been brewing in a lot of ways since probably 6-7 years ago, man.
Yeah. So a lot of people go into like fitness and nutrition and stuff and like, yeah, I'm super interested in this stuff, but they never actually like come to realize anything about preventive medicine. You realize that a lot of people, when you start getting into like fitness and working out, they know nothing about how it translates to their health or like how it translates to them living in a better life, more longevity, anything like that. So how did that realization come about?
So I think it was during or around that time when I started working with people on their own fitness, when I really saw the impact. And even then, my knowledge base was still compared to what it is now, and it's still growing, but my knowledge base then was much smaller than it is now. But seeing the difference you could make, I had some clients going from, 300 pounds to 180 pounds.
Wow.
Definitely. They were moving better. They were, talking to their doctor about being on less medications. They were improving their lives. They were feeling better. And towards the end of that process too, I had graduated and gotten my bachelor's degree in nutrition. And so I was also incorporating nutrition consulting in my personal training or in my CrossFit training as well. And seeing the difference that could make, the combination of nutrition, evidence-based nutrition practices that are beneficial with exercise, with kind of an overall lifestyle change in mind, and just seeing the huge change it can make in people's lives was like, man, this is awesome. So it kind of gave me that idea of, what if we could incorporate that into medicine somehow. And again, my knowledge on what happens in the I guess the medical side of the world at that point was almost nothing other than, getting my yearly checkup or whatever. So so that's kind of my story. Just kind of getting into things. And then throughout medical school, I actually ended up getting mentored by the Austin Baraki, Dr. Austin Baraki.
And if you guys are listening to this, you probably have already heard of that episode. And if you haven't, make sure to go check that out. It's the first episode we had, and it was an absolutely fantastic one. So
yeah, Dr. Baraki was great. He became an adjunct faculty for my school.
Really?
He was my mentor for this I forgot what it was called. It was like something humanism in medicine. Okay. So we started going over all these studies.
How'd you get in touch with him? Because that's not someone you could just like stumble upon.
I know. So it actually was totally random, right? So my freshman year of medical school, I found Barbell Medicine as actually just from Jordan Feigenbaum's Instagram. And I was like, at that time I was competing in powerlifting, and I was like, these guys offer coaching. So I just randomly applied for their coaching and got assigned. I think Austin got assigned to me. So I guess that's the way maybe they just like shift out their clients. But so it actually, the funny thing is I was hoping to get coached by Jordan, because I didn't know anybody else on the team yet. And then so Austin started as my coach. He felt,
who's this guy? Yeah. I want Jordan.
And then I think through one of our early weekly check-ins with Austin, we ended up talking about medicine. I told him, hey, I'm a medical student. And then from there, we kind of just got into a lot more of he became a huge influence on me and mentor for me. He helped me erase a lot of silly ideas maybe that I had. And then we spent a lot of time in discussions in the year between my first year of medical school and my second year. He had sent me this book, Explain Pain Supercharged, which is basically this book on all the science and data behind chronic pain and how we, experience pain. And we ended up going into.
We should talk into this part.
Am I not? Is that better?
Yeah, because sometimes you go like.
It's like kind of going away.
Yeah, you got to make sure you go straight into it.
All right, yeah.
There's technical things.
I'm still a rookie on the technical side of things, as you could probably tell at home. But no, so we ended up going into a lot of the data on pain and, kind of that experience for folks, and that opened my eyes to a lot of things. And Austin's been a really good friend of mine, a good mentor to me going through medical school, and that kind of opened my eyes to kind of how we can combine all this. So, shout out to Barbell Medicine, kind of paving the way for us to, make our hopefully our niche and, make a difference out there, help them make a difference out there.
Definitely agreed with that.
So what about you, man? So I know, you've definitely made it clear on your personal YouTube and kind of talking about your story about you were diagnosed.
By the way, if you haven't seen my YouTube, go check it out. Repping that RS Fitness shirt too. Perfect timing right here.
Dude, so, I know you're people who are known to your YouTube know your story where you were diagnosed with hypothyroidism at a young age, had probably some poor eating habits like myself.
You're
back
taking
in the
all my
day.
talking points. So am I supposed to tell them now?
All right, I'll shut up. You tell them your story.
All right. No, it's fine. But so essentially what happened, I don't know if you guys have seen anything that I put out there, but so when I was, I think it was 4 years old, I always forget the exact year. Sometimes I say 3, sometimes I say whatever. I was young. So I went to a beach at one point and then drank some seawater there, got sick. It was on the news that apparently the beach was shut down because there was some sort of bacterial outbreak there. And then I got sick. So we're like, okay, it's just the bacteria from that beach. I'll be fine. But then I got over the sickness. But then over the next year, I kind of just kept gaining weight and didn't grow in height. And you can imagine for anyone who's like 4 or 5 years old, you're supposed to gain some height there and like not get that big. I was a really active kid before then. My mother always describes I was like literally running around before I was 1 year old. So I was like super active. And then all of a sudden I was not active. I was getting like huge. In my personal statements for medical school and like applying for residency, I always described myself as a bowling ball at that point. So I was
growing the wrong direction.
Yeah, exactly, going the wrong direction. So there was that. And then eventually I got diagnosed. It was a very strange diagnosis. Now looking back at it, now that we do know medicine of somewhat, typically we think of thyroid through like a couple ways, but mine, there was like, they literally like ate the thyroid gland, whatever it is. So
you think it was some sort of like
some sort of flesh-eating bacteria.
That's like the most random, like it's crazy.
I know, it's pretty crazy because when they did the ultrasound, now looking back at it, that I like think about this from a medical standpoint, when they did the ultrasound, it was like literally missing chunks of thyroid, like someone took bites out of it.
That's crazy, man.
Yeah, it's a weird diagnosis for sure.
So you've been on medical therapy for your hypothyroidism since
So
then.
I have to take levothyroxine or Synthroid, which is the brand name, for the rest of my life because I just don't have a thyroid gland there anymore. So I was diagnosed, but that weight that I kept on kind of always stayed there. And I guess I also am a lover of food, which as you get older, obviously, yeah, it's not necessarily the most self-serving thing at some point, but hey, life satisfaction, right?
Right. First world problems.
Exactly. So when you grow older, you like get a bigger appetite, right? So my appetite kept getting bigger and I loved food. So I kept eating and I had not necessarily the best eating habits. So I kept a lot of that weight, never lost it, and kind of just realized and accepted that I would be the fat kid for the rest of my life. And I think a lot of kids when they're going through school kind of accept that role because you see all your other friends that are like normal, quote unquote, and you see yourself as big and you're like, all right, this is me now. I'm going to tolerate some sort of bullying. I'm going to be the kid who's not as, who doesn't look the same, who's not going to get the same, I guess, acceptance from their peers sometimes.
Yeah,
so
yeah, you're like, it's kind of that you almost, should we pause while we're experiencing some sound difficulties from okay, so I think we're good. But so you kind of, it almost develops or causes you to develop at a young age a defeatist mindset, right? Like
100%.
Like you don't have that self-efficacy that others have because you're just like, well, I'm the fat kid. That's just who I am.
Yeah.
You just identify with that. Like there's nothing you could do about it.
Yeah.
It's just, that's who you are.
I mean, also there's one aspect of that. I wouldn't say I was just like accepting myself as a fat kid. I just thought it was normal. I was like, this is me. This is who I am. And it's not like I was defeatist as saying like, I am the fat kid. Therefore my life is not as good.
Not necessarily negative.
Exactly. It's just like, that's your identity at that point. And then when you're a kid, you don't really have any health problems, right? Because every kid is plastic. You're not really going to have any injuries. Like if you fall or anything, your metabolic health and everything is fine because you're growing, you're a kid, right? So I kept up that way. And then in high school, like Jason was saying, he was 260 pounds at what, like 6'2" or something?
Yeah.
I was 260 pounds at like 5'8", which is a completely different picture. It's kind of still like that bowling ball. And at my yearly appointments, bi-yearly at that point with my endocrinologist, he would always say I need to like do some sort of portion control. I need to lose weight. But there was one specific appointment that I had where he was like, yo, you like actually need to do something about this, or you were, I don't know how I didn't already develop it at that point, but you were like, you're going to be diabetic in the next couple of months and you're going to shorten your lifespan if you get it at this point. And I was like,
What?
We got to do something about this now. So the first thing,
it's like you're being faced with like chronic medical diseases as a kid.
Exactly. At 16 years old. And thank God I understood what that meant at 16 years old and brushed it off. And thank God I also had a very good endocrinologist. Shout out to Dr. Zeller. That was able to like communicate that to me in an effective manner.
So one of the things that's interesting about Ragav's story is a lot of times, we hear folks who are overweight, they kind of default to the thyroid, right? Like, oh, there must be something with my thyroid. But there actually was something wrong with his thyroid. And still, on top of, even when he was adequately managed medically, was still gaining weight. So it's one of those things where you can have multiple issues, and like apparently that your endocrinologist thought that you were managed appropriately and still gaining weight. So,
yeah, I mean, if you read through Instagram and a lot of things, people are like, yo, I have hypothyroidism, that's why I can't lose weight. But if you have the appropriate medication for that, you can still lose weight. The medication is essentially there to make you like physiologically normal
just
again.
Normal, yeah.
And then after that, it's up to you. It's your behaviors and whatever you eat, your nutrition, your exercise, and everything else that comes along with that.
So is that around the time when you started exercising?
Yeah. So like Jason, once again, I kind of just had the bad food, good food mentality. And the first thing I did that I always say, I went home and I looked up how to get a six pack. Cause that's obviously like, that's what you want to do, right?
That was my goal too. When I first started losing weight was like, I had zero health thoughts on my mind. I was just like, I want to get a six pack.
Especially being in high school, it's like, yo, let me get a six pack. That'll solve all my problems.
I feel like that's for like chubby kids growing up. That's like the holy grail.
Exactly.
It's like that's the epitome of health right there is having a six pack.
Exactly. So yeah, I went home and I kind of just started on the whole process. And although I didn't have like the quote unquote correct approach at that point, where I was just like cutting out foods left and right, I did start to see some results. I started hitting the gym more consistently, and yeah, I just started to see the results and was like, wow, there's something to this here. And then it just kind of went on itself, and now we're here.
It is interesting you say that, because there's a lot of discussion currently, I guess, on the fitness world, the strength training world, about optimizing your beginning progress. And kind of, I think what the data supports and what the popular idea is right now is that really what tends to happen with folks is whether their beginning training can be totally suboptimal, which both of ours probably was, because same way I would go in the gym and, do a lot of bench press, biceps, and
I did. So I have like chronic shoulder injuries on my left side because of how poorly my form was, like how I was lifting at that point. So definitely regretting that now.
But it's like one of those things too, where we both, like it almost snowballs into wanting to learn more. So maybe you have we had, not the best, I guess, knowledge base at the time, but we made good progress because we worked hard and we're consistent. And it almost causes, or it caused me at least, to want to learn more. And that kind of built its own momentum, so to speak.
Exactly. As we're talking about in several of our episodes, we say like these little changes just kind of compound on themselves, and then it makes you more interested and more eager to kind of go to the next step. And then it just builds on itself. So I think both of us have a very similar thing where we started, and it doesn't matter where we started. Like obviously we were doing things wrong. We had no idea what the hell we were doing, but we were doing something and we were consistent with it, and we saw results, and we're like, okay, maybe there's something to this.
Yep.
And then we kind of look up how to actually do things properly, and then it just keeps going from there.
And I think, for personally, I think that kind of highlights something important as well is, at that time, once others started to realize that I was making good progress and it could be visible from the outside, people would already, as at age 18 with me at the time thinking I knew a lot, but not really knowing a lot, that full Dunning-Kruger effect. People would come to me for advice, and I was probably giving people, like friends and family members, not the best advice at the time, but it's one of those things where it's like we talk about all the time why there's a need for professionals in this space, and that can be part of the reason why. I mean, because the fittest person you see doesn't necessarily mean that they exactly know what they're doing, right?
Exactly.
So that's one lesson that I learned too, looking back at, I kind of cringe at some of the advice I may have given friends and family at age like 18, 19. But even some of my own beliefs, I mean, it's definitely something that grows over time. If you choose to want to learn and be open-minded to finding other folks who know more than you, and leaning on them for kind of help growing in that direction, that's a good I'm glad that happened in my life.
Yeah. And then that same thing where people start asking you advice, I started getting like a decent amount of that. Cause when you're 5'8", 260 and you start changing your body composition, it looks pretty drastic to a lot of people. And at my leanest, I got down to like 170 pounds. And
same. We had the same top weight and like the same bottom weight. That's funny, dude. Yeah, man, I was like 172 pounds or something like that at my lowest.
So I had gained a decent amount of muscle. So when you get down to 170 pounds at like 5'10" at that point with some muscle, it's a pretty drastic effect. So people were like, yo, what are you doing? Like, can I get some of those steroids too? So at that point, that's why I started my website, Ragav Sharma Fitness. That's what it started as, because people were requesting like, how do I get help? So I started just like writing things down of different tips that I would give people, because I didn't want to just like one-on-one give it to everything. I was like, here's an article.
So did you start a business at that time?
So I was quote unquote business, maybe you could say. I kind of just offered some coaching, and then it was just a bunch of my friends who would pay me kind of just to make a program or to help them with their nutritional advice.
So I think in different ways, we both kind of realized the potential for, you know, this kind of what we're doing now, even a long time ago, just maybe not having the full means or full, I guess, networking potential at that time to make it work. But I definitely think that, you know, when I started actually working in fitness, was when I really realized that the future of kind of spreading information is not going to be person to person like we're sitting right now, just because at that time social media was just starting to blow up. I think like 2012, 2013 was right around when Instagram started getting really popular. Twitter was already popular at that point. So it's like, look at how many people you could reach, you know, that you don't even know.
Honestly, sometimes I want to like, I wish I was like 4 or 5 years older, because then at that point when things did started to blow up in 2012, 2013, it would have like been somewhat established to like actually give good advice on a larger scale and know what we're doing. Whereas now, obviously, it's a little bit saturated in what we're doing. We're obviously still hoping to make an impact. And even if we have an impact of like 1 or 2 people, it's fantastic. But you got to look back and be like, damn, I wish I started back in 2012 and like knew what I was doing.
Right at the boom of that stuff. Yeah. I mean, you look at some of the bigger fitness, health people that are on social media. That's when they started.
Exactly.
Yeah. And I think, you know, it's one of those things that we're both still in this learning process. But what would you say you've learned what's been the biggest thing you've learned since we started putting this together a little over a year ago?
So the biggest thing that I've learned is actually kind of more of a reframing. So I feel like I've learned a decent amount, because my personality is, if I want to do something and if I'm like trying to learn about it, I just dive all the way into it, try to do as much as I can. So it's kind of, there's a difference between knowing things and knowing how to apply those things and being able to reframe what you know into a way that can help people.
Make it useful.
Exactly. Yeah. And I think that's what I'm learning more of right now, because I've written a lot of articles for my website. So like all this information has been there, but I don't think I've ever actually been able to like package it in a way that's going to help people and actually reach people so that I can make an impact. And I think what we're doing through this podcast is one of the ways that I've learned how to transfer all this information, make it digestible into a way that other people can benefit from it too.
Yeah, I think that's a really good point. And I think one of the biggest things I've learned in this year is, one, how much work goes into just even if we have no listeners, we just to get this thing live and get it going. I mean, the hours of writing, the hours of just, us talking about, our vision for what we want to accomplish and, aligning those things, finding guests, finding time to sit down with guests. And then we got hit with COVID.
Yeah. COVID has been a huge challenge, because initially we wanted to do everything in person, obviously.
Yeah, this was supposed to be the format for most of our podcasting. Yeah,
because the audio is going to be a lot crisper when you can get everyone in person versus recording things over Zoom. So we've had a lot of challenges in the past several months.
And so of all of our first 9 episodes, this one, and we have one other episode that was with our guest in person, and the rest were via Zoom. So shout out to Ragav, though. You figured out how to do the Zoom and
it's a audio process. Man, I don't know how to do anything either. I'm just trying to learn how to do it myself and put it together, and hopefully it's acceptable.
Yeah. And so for those of you that don't know where we're at right now in our training, so we both just began our 4th year of medical school. What that means to us is this is a big year. So we are both in the process in the next couple months of taking our last written board exams, applying to residency programs for the specialties that we're planning to go into, and then interviewing at those programs And then by next spring, we'll hopefully know where we're going to be for the next 4 or 5 years.
Yeah. So Jason here wants to go into anesthesia. And why do you want to go into anesthesia?
So it's kind of a weird how I stumbled upon it. Going into medical school, I could have told you with all my heart that I was going to be ortho.
Yeah.
Like
whenever, by the way, for anyone who does not know anything about medicine, whenever you see someone who like lifts, is somewhat in shape, and like a dude, ortho, like you just get labeled ortho and that's it. You're done.
People just, I mean, you don't even have to tell people what you want to do. They're just like ortho. You know?
Exactly.
But so, you know, and I worked really hard during the first 2 years. So again, another kind of behind the scenes medical school thing is, you know, one thing I learned going into medical school beforehand was you don't just pick what you want to do and then you do it, right? You got to score well, like, depending on what specialty you want to go into.
There's a lot of hoops to jump through, no matter what you want to do.
Yeah. So, you know, I definitely geared up to make sure I was in a good position to apply to ortho. And, but then during third year, I had my ortho rotation and it was a great experience. I had a great preceptor. It was I got a lot of hands-on experience. But then I found myself not loving it. And I thought, it's only been a month. That's a problem, right?
Yeah, exactly.
So I started kind of looking into other specialties I know I wanted to do something that was hands-on.
All you did is you looked behind the curtain at the anesthesia guys. You didn't go far.
I literally, and I actually, in my general surgery rotation, I had a conversation with one of the anesthesiologists, and I kind of at that point, I didn't know much about anesthesia other than they put people to sleep. But we had a conversation about
and make sure they get up. By the way,
yeah,
that's the most important part. Not putting them to sleep.
Probably the more important aspect. But just the actual broad scope of things that anesthesiologists have to know, how to apply it, and then different fields you can go into, such as pain management, critical care, cardiothoracic. But I just recently finished my first anesthesia rotation, and the things that I loved about it the most were you get to see the fruits of your labor very quickly. So, you're doing a nerve block for a surgical procedure, and within a minute if you did the job. It's quick on, and then you kind of have a little bit of a break, kind of just making sure everything's good with the patient, and then you got to wake them up again, do that whole process again, follow them to their post-surgical care. So I just really liked all those aspects, hands-on, broad base of knowledge for pharmacology, physiology, pathophysiology, and then that instant gratification of you do the work, you see it, it's good, you're done.
By the way, if you guys are listening to this, are not watching the video, then this wind behind us we're sitting outside. There's also a plane flying above us right now, so just bear with us on any difficulties for this podcast.
So yeah, on that note, so Ragav, you're going into physical medicine and rehabilitation. Yeah. So tell us a little bit about why you chose that and what you're going to do down the road.
Yeah, so physical medicine and rehab is a very unique field because honestly, not many people know about it. If you tell them I want to go into PM&R, they're like, PM and what?
Yeah.
What is that?
What does that mean?
So physical medicine.
Or a physiatrist?
Exactly.
You're
exactly.
a psychiatrist?
So that's actually funny you say that because I sent an email to my clinical coordinator at medical school saying there's a physiatry rotation I want to do. And I sent her the syllabus for it. And she's like, this has nothing to do with psychiatry. I was like, this is physiatry, not psychiatry. So even in medical school, people don't know what it is. And even a lot of physicians, for some reason, still don't know what it is. But
I think it's kind of, I don't want to say it's a new field, but it's definitely become more prominent. More people are applying.
Definitely. So the field itself started after World War II. And it was really a combination of two fields. There's physical medicine and also rehabilitation. And it kind of came about because there was a lot of soldiers coming back with a lot of injuries. And people didn't know how to take care of them. And they needed a lot of rehabilitation. They had a lot of needs. And there wasn't really a field that kind of was dedicated to that. So physical medicine rehab kind of came about to fill that need. And since then, it's been kind of blowing up because it just has a very wide scope of practice. And as the years go on, and every year, it seems that the field gets broader and broader because in physical medicine and rehab, you can do a wide variety of things. You can do things like interventional pain, like what Jason was talking about with anesthesia, where we also do those nerve blocks and whatnot. But you also go all the way to the other side where you have a patient who just had a stroke, and then you're kind of helping them deal with the symptoms of their stroke and kind of finding out what they can do. Exactly, their new obstacles and helping them rehab back into the world. So physical medicine and rehab kind of is just very broad, and that's one of the reasons that I'm very intrigued with it. And I was lucky enough to actually find out about it before medical school even started, through just shadowing physicians before getting to medical school. So it's been amazing.
a little bit, depending on when we release this episode, some of you may have already heard our podcast with Dr. Tariq, who was a fantastic guest on our podcast, also a physiatrist. Yeah. He kind of opened my eyes a lot to the preventive side of PM&R, you know, where we talked about some things like you just said, like stroke patients, right? Part of that job is preventing more adverse
stroke.
events.
Yeah, exactly. So, and it's not just the second stroke, it's also the other things that come along with a stroke. Like, for example, you might not be able to exercise as you were before. So you increase your risk of like heart disease and all these other things that come along with that. So you kind of have to look at the whole patient when it comes to PM&R and like rehab in general.
Which, speaking of the whole patient, that actually kind of is probably a good time to talk about, you know, we're both osteopathic medical students, DO versus MD. So, I know myself, I didn't know what the DO versus MD was at all until I actually applied to medical school. So can you tell us a little bit, what is the difference between an allopathic or an MD program and an osteopathic or a DO program?
Yeah, so the main difference, and in reality, they're pretty much the same thing at this point. And the main difference is that in an osteopathic program, you learn manual medicine. So the theory behind osteopathic medicine is that for some reason, back in the day when they were creating it, they saw allopaths not really like putting their hands on patients, kind of giving them medicine and like saying next in line, move on. So
yeah, and we're talking hundreds of years
exactly.
ago.
We're not talking about like yesterday or last year. We're talking about like when it was founded, when it was, what was that date again? We're supposed to memorize this for school, but I forgot it.
I want to say it's like
1870 something.
Something. Yeah. The banner to the wind day.
Exactly. So yeah, that's why osteopaths like started practicing osteopathy, like put their hands on patients, really understand what's going on with them. And they also thought that a lot of the problems that people had could be fixed by manual medicine. So like physically manipulating parts of the body. And although a lot of the practices that they used to have like way back then have kind of been watered down now as science evolves and we figure out more about how things actually work, there still is a very large component of manual medicine that is beneficial to patients, like very simple techniques that maybe can help them so that they can do other forms of therapy afterwards. So it's kind of why I applied there.
So yeah, just to kind of piggyback off of that. So like Ragav was saying, how the curriculums now for both of those sorts of programs, if you went to an osteopathic versus an allopathic medical school, aside from I think it's a 200 to 300 hour mandatory hours we have to have for the physical hands-on training. The other curriculum is the same. We take the same board exams. You end up in the same residency programs. And so now more and more we're seeing to I guess fill this physician shortage in America, more osteopathic schools pop up. And so I think by the time we graduate, or a few years after we graduate, about a quarter of all physicians that you will see in hospitals and outpatient or wherever are going to be DOs. So it's one of the things that is something I didn't know about going into. And so, sometimes you'll see, on someone's white coat or on their name, Dr. So-and-so, DO versus MD. We will be DOs, but that will give us the same licensing and practice rights as MDs.
Yeah. And I think, I don't know if whoever's listening to this knows a little bit about what's going on in medicine, but essentially they're heading towards the same route. They kind of merged like last year. So it's kind of just essentially going to be the same thing in the next couple of years. So there's essentially no difference.
Yeah. So, what Ragav was saying is basically the residencies that we apply to are now all under the same
banner.
Yep. So we're all hanging out in the same playground now, so to speak.
So when Jason and I met, we were actually already like halfway through medical school, and we had both completed our first 2 years, and I think we started
before step one. I think
right before step one is like essentially when we started talking to each other. And I just want to ask you, how did that process go? Like, how did we meet, and like what happened there? Because I'm from the Chicago area, and although Jason's extended family is from here, right?
Yeah. So I grew up like probably 20 miles from here.
Exactly. But he went to school in Indianapolis, essentially. So how did we meet? I just want to ask you.
So it's kind of an interesting story because I think there's a little bit more, there's like kind of some randomness to it, but also kind of like, whoa, like a small world thing. So we actually I think we saw each other's Instagram accounts. We both were commenting on the same Instagram account.
So we've like followed the same people and we're commenting on them. And then I think at some point I saw a couple people's names and I was like, who are these people?
I think we were
Let me click on the profiles.
Yeah, because I think in one, there was like a comment thread that was getting heated on nutrition.
Yeah.
And we were like basically saying the same things almost. And I think we kind of were in the same.
Like, who dis?
Yeah, right? And I was like, so I think it was kind of that, just kind of almost an organic process of meeting each other, seeing each other, being in the same. Then I was like, oh, this dude lifts. So he lifts. He has some good ideas about nutrition. He's in medical school. I was like, this is a kind of a crazy coincidence. And then also one of my sister-in-law's good friends at the time is one of Ragav's classmates. So I had actually heard of Ragav before I even figured out that person that I had met on Instagram was Ragav. So shout out to Nick Corcoran.
Good to know he was talking about me too.
Yeah. So I think you actually were like writing a strength program for him at the time.
I was.
Yeah. So like he had mentioned one of his classmates was writing a strength program for him. And then, and when we initially started talking was probably the most stressful time of both of our lives, getting ready for arguably the biggest exam we were ever going to take in our lives. So we kind of met and then didn't talk for a while after that. And then after some time,
do you mean by, we met as in like the DMs, you mean?
Yeah. So like,
so we were like DMing back and forth on like a couple things. Like he would post something on his story and be like, 100% agreed.
Yeah,
that's excellent. Then he'd do the same thing for me. And it was kind of like that back and forth. It's kind of like, honestly, I was talking to my girlfriend about this, about how we met when I posted that behind the scenes thing on our Instagram, which by the way, go check out our Instagram if you haven't already, at Prevent Podcast. Yeah, exactly. She was like, it's kind of like dating. Like you guys were in the DM.
Dude, that's so funny, but it's so true. I mean, it's almost like you like, oh, this person has qualities that I would appreciate in a business partner or friend or whatever. But no, it kind of is remarkably similar to dating, although hopefully not too similar.
All right, let's move on.
So and then a few months down the road, once things kind of calmed down for our third year rotations, was kind of getting into the routine of it. I really wanted to pursue this idea of, getting out there into the social media or finding another avenue for getting this message of preventive health out there. Because, other than just seeing patients in clinic and talking to people in my personal life, I felt like there was a bigger impact. And I knew already that based on seeing some of your YouTube content and some stuff that I was like, all right, this guy is already doing this.
At this point, I had my website for, I think, a couple years now.
And you wrote a book.
Yeah, I wrote I've been doing a couple things to try to like have whatever impact I can at whatever stage I was. So I had a website with articles covering different topics in nutrition on there. I was offering some sort of coaching at that point to, I guess, whoever asked, like Nick, our buddy Nick. And I was also making YouTube videos at that point. So I was kind of already putting myself out there on Instagram where I was posting everything. So Jason saw that and he was like, yo, you want to collab on something?
Yeah. And it kind of started like we were at the beginning, we were unsure of how to make it work, because you have, you definitely were doing your own stuff that you wanted to keep working on and definitely like not completely forget about.
Yeah, it's like under my name.
Yeah, right. So you can't just give up on all the stuff you're doing. So I think there was a little bit of kind of just us brainstorming of how do we make this work? What's the best avenue? And eventually we settled on a podcast.
We met in person first though. So Jason he was coming in because his in-laws he was meeting with his in-laws, right?
They live like 15 minutes down the road from where you're at right now.
Yeah, exactly. So we decided to meet in person at that point and we sat down for breakfast and we just started kind of like chatting, kind of like this episode right now, honestly.
So all great things start with breakfast food. I guess that's what we sat down kind of like, and even though we were kind of still in that process of like, I don't know, like what, like just trying to figure out what's the best way to not blow off school. You continue to want to, for you to be able to continue to successfully pursue the things you wanted to. And then for us to merge these paths into a separate kind of business entity or a separate avenue.
thing.
Yeah.
We don't exactly know the like business directions that we want to take. Exactly. We don't know what direction we want to take it. But yeah, at that point when we met, I was already doing the YouTube thing with my own personal channel. I was already like writing articles and I was kind of just trying to figure out what another way is that I could impact people with a way that's not associated to my name. And honestly, I was already kind of thinking about doing a podcast at that point. I just had no clue how to do it. And then when we met and we started chatting, we kind of just fell upon the idea of starting a podcast together and figured since he could be local sometimes, and even you don't need to be local for podcasts, like you can do them virtually.
Definitely learned during the COVID
exactly
experience.
as we learned out. We just figured it was the best thing, and then from there we kind of just started figuring out what the podcast would be about, what the message would be about, how we could collaborate together to get our shared vision of what we think we should be doing in healthcare, how we should get that out there. And we kind of just stumbled upon the name, the Preventive Medicine Podcast, because I was looking through the iTunes store, and honestly, this is the way that a lot of things come about. You just scroll through, and I didn't see anything on preventive medicine. I was like, all right, let's be a little bit authoritative here, because we want to be the guys for preventive medicine. I was like, this is the Preventive Medicine Podcast, and here we are. And
so, yeah, I mean, that's a great, I didn't even, like, I kind of sometimes forget that that's how we stumbled upon the name, but it's one of those things that, you know, we were kind of looking for a space that wasn't already occupied.
Exactly.
That we could fill kind of with our own, you know, future expertise. Not that we're anywhere near experts yet, but our future expertise.
And that's why we also decided upon sorry to interrupt, but that's why we also decided on interviewing other experts. Because at this point, we both collectively decided that we are still medical students. We don't necessarily know exactly what we should be saying to people because we're still in the learning process. We still have to go through residency. So why not find the actual experts, the people who are actually taking care of people who are making an impact, and amplify their voices so that we can give like good information out there and get those voices out and actually help people.
And I think speaking for myself, I definitely have, you know, gotten a lot of learning out of this. I've learned a lot from each one of our guests that we've had on there. And, you know, I think, like you said, amplifying the voices of people who really are experts, it has been our initial goal. And I think, you know, as we grow, our goals will probably shift a little bit, and definitely things will change over time. But I think for the way we wanted to get started was, you know, definitely we know some things. We're not, you know, we're
both of us have like our own experiences. We've both been deep into this learning. Like, we're not just the type of people that we were talking about earlier in this podcast where like you're doing things, you don't know why it happens. Both of us like heavily research these things of why things are happening, because exactly we're interested in like what's going on.
Yeah. And so at the same time, we're kind of unsure about the legality, being medical students, you know,
exactly.
Being very clear that everything we're doing is for educational and entertainment purposes. This is not medical advice. And so like, that's the last thing either one of us wanted was to be ended up.
I'm not trying to get in contact with a lawyer right now.
We have enough on our plates to not worry about that. But yeah, so one of the ways we figured our way around that kind of complication was, you know, we can assert some opinions here and there, but also give the main platform, as you've probably heard on our podcast already, is it's probably 80-20 our guest talking versus us talking. So you get the actual experts, and then you get to hear us chime in a little bit.
I'm sorry if you really love our voices, and I'm sorry if you can hear this train as well right now. It's kind of a little annoying, but you hear us in just a little bit, and we want to make sure that, as Jason was saying, we amplify the guest voices, and really we're trying to find as many people as we can that are very qualified to give information, and not only just information, because there's a lot of people even with degrees out there, like with that background, that aren't necessarily evidence-based for whatever reason, when the evidence that is existing in the literature clearly shows that something is more beneficial than the other. But so I don't know why people are not evidence-based in that sense. So we want to amplify those voices, which are like making sure that this advice is appropriate.
Right. And, you know, that's one of the things that both the kind of physicians we would like to be are not those physicians, or, you know, people with PhDs do the same thing. People with whatever title, right? Insert title here. And then you're using your title to sell an idea that isn't really backed by evidence. And so trying to find those folks who are, one, going to be in the, I guess in an official sense, an expert, PhDs, MDs, master's degrees, and also abiding by the evidence in whatever field they're using or working in. And so we've definitely found there are so many great people out there. And if you're watching this, if you're listening, we are always looking for guests. If you're doing research in some field, if you're a physician, if you are a fitness expert, nutrition expert, whatever, if you consider yourself an expert,
slide in the
field,
DMs at Prevent Podcast.
At Prevent Podcast. We are definitely open to talking to you guys. So we're definitely brand new at this. So the more interaction we have with you all, the better.
Yeah. So where do you see this podcast going in the next, like, let's ask you your 1 year and your 5 year view. If we're going to get to 5 years. Let's be honest here.
I believe in us. I believe in 5 years.
But where do you see this podcast going?
So, you know, I definitely think, you know, as we kind of grow in the first year, I think I'd like to see us grow in that social media space. So I think that's one avenue where, I'd like to see us, I don't know if I have a number of followers in mind, but I'd like to make a dent in the social media world, whether it's Twitter, Instagram, and actually get our podcast into a spot where we're getting consistent listener base, a consistent networking between different accounts and different people.
To jump in here, I think that's not necessarily just because we want the numbers. I mean, it's nice to look at that thing and see 100K
just
followers.
To reach more folks.
But we want to make sure that, number one, we can reach a large amount of people because we think our message is what we should be like putting out there, as well as we want to kind of drown out those voices which are not doing like something good for the people. There's a lot of voices on social media which are providing not necessarily harmful information, but stuff that either doesn't work or is flat out harmful. And we want to drown those voices out with the good information, which is really hard to do, it seems.
So in one sense, just fighting the good fight of, hopefully giving a voice to people who should have more of a voice.
Exactly.
So I see in the first year, I see that being my biggest goal with the podcast. 5 years from now, I would like to see us branch out into other sort of avenues, whether it's seminars, written content, books, articles, whatever, and kind of get more into more outside the social media space into
the real world.
Yeah. Kind of unplug from the matrix a little bit. And maybe it's seminars, maybe it's, in some weird way, maybe it's in our own individual practices down the road, incorporating what we're doing together. Maybe it's growing a physical following of folks other physicians who want to join that namesake of preventive medicine docs. And so I could see it being huge.
So I think the idea behind any lasting idea in that sense is that there's like a strong reason behind it of why you're doing it and why you think this is so important. I think that's definitely there for this podcast because as we've seen in both of our lives, preventive medicine is like, it's very important and we need more and more people to practice it because if you've listened to any of our podcasts or seen any of our things on Instagram or Twitter, then you know that there's a problem in the US and we have chronic diseases which are absolutely going out of control.
Which, not to cut you off there, but we do, like one of the first things we did was actually put a series of posts together about why this is such a problem.
Exactly.
And so if you go back to you scroll down and look at some of the earlier posts we've made on our Instagram account, you'll see cardiovascular disease, diabetes, stroke, obesity, those things that are really hurting people and why, like basically our why is in those posts.
Exactly. And it's not necessarily even that we want to like treat those or we want to like help. It's because let's put that back. At this point, if we have this many chronic diseases like keep going, then we're not going to have enough physicians or not enough capacity in the healthcare system to deal with it. So even if we do like have all these diseases going, some people might say, all right, why not just treat it? We won't be able to. And this is why we have such a high mortality rate for some of these diseases, which is absolutely staggering. And people shouldn't be just dying from these diseases that can easily be preventable with like a little bit of knowledge that we're trying to get out there. So,
and I think that one of the reasons that we both pursued something that was outside of the hospital system or the current, formal healthcare system is, I've seen it firsthand on my rotations. I can't speak for you, but these doctors get out there and they're immediately overwhelmed with the amount of work that they have. So almost not any, but probably a large amount of their efforts are already going towards managing this huge problem or these huge numbers of problems that we have, and that they can't practice in a way that, or maybe they're stifled in a little bit in a sense of trying to practice preventive medicine because it's like they're trying to put out this fire and then there's more fires growing, so they can't, maybe practice in the way that they dreamed when they went to medical school. And so hopefully by working outside that space, we may be able to kind of do both, work from both ends of this situation. All right, student doctor Sharma, where do you see us in 1 to 5 years?
All right. So I was talking about the why of like behind the podcast that we have in the message. And I think I'm right there with you on that year one of trying to get it out there to more voices or get more voices out there and get a larger audience and try to grow that number. And I don't think there's an exact number that we like to hit, like you said. And I think it's pretty arbitrary. You can't say like, I want to reach 100K people. And then like, you're just setting an expectation for yourself that you don't know if you're going to meet that. You have no clue what's going to happen.
But what if you're setting an invisible ceiling on yourself? Like, okay, we hit 1,000 people. So,
there's
like
that too.
Whatever number.
Yeah, I think in the first year, I think we kind of want to get more of a hang of what we're doing here and really kind of like understand this is how you run a podcast. This is how we get our message out there. This is the type of people people. This is our audience. So if you're listening to this, you are our audience. We're trying to figure out who's going to listen to this and how we kind of get the message out there. Because the thing here is not necessarily like we're trying to record a podcast just for fun. We want to make some sort of impact in the future. And we want to have
100%.
like an impact on healthcare. So we want to make sure that we can get this out to as many people as we can, who our audience is and how that audience is going to spread it to the rest of the people. So
yeah, 100%.
I think a lot of that comes from social media at the beginning. So I think the first year of this podcast is going to be definitely solidifying that and understanding what direction we want to go to with our audience, with marketing, and like kind of figure out systems and processes so that it can kind of run itself for that 5 years.
Well, you know, I think one thing that the whole process has taught me is that, and I guess I've learned in the last year or so in general, is that how powerful social media is, because if it was for social media, we wouldn't be sitting here right now doing this. Yeah. Some of the guests that we've had on the podcast purely met through social media.
Just a random DM slid in, and there we are.
You know, kind of an aside, but one of our guests, future PhD candidate, Alyssa Olenek, and I will be running a 69-mile race together, ultra marathon in October, and that's totally, we just met same way we met. You know, so it's kind of crazy the power that social media can have, and so I definitely don't want to underestimate or underscore the potential that even remaining on social media, a huge difference can be made in that avenue as well.
Definitely. But I agree with you for the 5-year outlook, and even 10-year to 15-year. It's not just the podcast that we have. I think it's just the idea that both of us really want to get out there. So if it ends up taking another form, whether it's like physical, through like courses, through whatever it is, we want to make sure that the idea of preventive medicine gets out there, because it's never going to go away. It's not one of those things in medicine that gets outdated. Like there's a better procedure, there's a better this, better that. It's something that's always there, and it's something that's always going to be there to like help humans optimize themselves in a way. So the message is always going to be there, and in whatever form we take, we want to make sure we get it out there and hopefully continue to expand our reach, because we want a national and, dare I say it, worldwide impact on this, because it's not just the USA that struggles with this. Everywhere is starting to struggle with this more and more.
You know, and I couldn't agree with that more. And you know, one of the things that's kind of hard to even fathom, because, you know, like I don't view myself as super important in any sort of, you know, social media or the medical world or anything sort of space, but you know, I'm
just a lowly M4.
Yeah, I'm just a lowly M4.
Not an M3 yet. Not an M3 though. So better than that. Better than that.
But then we'll be at the bottom of a new totem pole in about 9 months as interns. But you know, I don't want to underestimate our potential to make a difference out there. And I think hopefully, you know, if we both, you know, if this goes where I think we both believe it can, I think, you know, this could be potentially something that in one way or another impacts the world in a very positive way.
And honestly, one of the things that I've been thinking about more and more is that no matter what physicians do, what there's going to be in terms of like our impact out there, at the end of the day, it might end up coming down to policy even, of like, what do we do as a country that's going to impact our policy so that we can create a healthier population? Because at some point, if you have rules and restrictions on something through like an actual law, then it's going to be a lot more effective than some people on a podcast just saying things. So
if
whether or not
policy,
we are making policy or affecting policy, that's a whole nother thing. But at the end of the day, we want to make sure that everyone is able to benefit and everyone's able to live a preventive lifestyle. So whatever form that takes, like I was saying.
Yeah. And I think, we've seen people in this space that kind of we're attempting to work together with them. And there's so much room for, I think, multiple people to do this, because like we said, there are so many voices that need to be pushed out of the way because they're being outright harmful or not helpful. And I think, unfortunately, sometimes the message of preventive health or evidence-based practices, I mean, just even saying evidence-based practices doesn't sound like a party, right? You're not like, it's not necessarily entertainment.
I was literally
right?
just thinking that stuff like preventive medicine is not like, it's not sexy. Like the people who are putting those things out there that are either not beneficial or harmful, those are things that get clicks. And those are things that people are like, oh, this looks interesting, I'm going to do it.
This one weird trick.
Exactly. Yeah. And those are things that people want to click on. And the idea of preventive medicine or living an evidence-based lifestyle and it doesn't get clicks. So hopefully we can try to expand beyond that.
And I think honestly part of that is because as much as I'd like to sit here and blame the other folks, like the people who are putting out the bad information or the people who are clicking, I think some of that burden falls on us to make what
Make
we're
it more
saying,
clickable.
make it palatable, make it clickable,
And that's what we're trying to do.
without compromising our soul, so to speak. Right?
Exactly.
But,
so if you are listening to this and you think everything we're doing is palatable, please let us know, because we aren't just here like lecturing you or trying to lecture you with all of our speakers. We're trying to get a message out there. So if
we're
you're
learning
listening,
with you guys.
Exactly. So if you are listening to this and you find that we can improve in some way, just do not hesitate to email us at the Preventive Medicine Podcast at gmail.com, or send us a DM on Twitter or Instagram, whatever it is.
Yeah, any feedback is good feedback at this point. We like Ragav mentioned earlier, we're so new to like even holding a microphone feels so strange to me.
I've been doing YouTube, so I'm a little bit more used to it. But
yeah, I mean, like,
not saying I'm a pro or anything.
So I mean, as I've been learning, and we've been trying to get this put together. I mean, there's definitely so much that only so much you can learn without getting feedback, right?
Exactly.
The more people we reach, hopefully, the more feedback we'll get, and maybe our setup gets a little fancier as we go along, and who knows?
Yeah.
Maybe we're at some giant medical conference one year doing this.
So just a little bit behind the scenes stuff about like all of our production stuff. So what we've been doing kind of for the last several months. So our idea behind this, especially being medical students in, like Jason was talking about, fourth year, which is a pretty big year for us, was to kind of get everything done out of the way. So we recorded the entire season 1 before we even launched it, so that we don't have to worry about anything. We don't have to worry about scheduling, about recording the podcast, about making the graphics, about making the YouTube videos. So we did everything before the season even launched, so we can kind of just like let it go on autopilot. And one of those things was also kind of creating templates and systems so that we can continue advancing it. Exactly.
One of the things I think too, and when we discussed recording all the episodes, you're kind of blocking out this work in chunks, is that I think we were both on the same page. Is we didn't want to put in all this work and discussions for a year and then have scheduling get in the way and cause the flop.
Exactly.
Right? So we're like, we had this time, let's get it done in between step 1 and step 2. And now we're kind of, reaching that next spot where we're kind of, I guess the next 2 months or so will kind of give us a better idea of what the next 6 months look like. But so one thing that we always ask our guests, if you've been a listener so far, is
here it comes.
What does preventive medicine mean to you? So I want to ask you, Ragav, what does preventive medicine mean to you personally?
So I think preventive medicine can take a lot of definitions, and I think the thing that we try to tell, at least that I try to tell other people, is that it's dependent on you, what it means to live healthily and to live a full life. Because at the end of the day, preventive medicine is about being able to do what you want to do and not being hindered by any health issues. So for me, if that's like being able to play with my grandchildren when I'm 80 years old, 90 years old, if it's being able to still travel the world, to go on hikes, which I definitely want to do. I want to climb the Himalayas at some point, go explore those parts of the world.
There's life to be lived, right?
Exactly. So I want to be able to do that and not worry about any conditions with health. Like, for example, if I have diabetes, then I don't want some like leg claudication or some neuropathy going on in my foot that holds me back from climbing the Himalayas.
You're not climbing a mountain if you have heart failure.
Exactly. You can't do that. So I think that's what preventive medicine means to be. It's having a foundation of health so that you can do what you want to do. And that might sound very similar to you because that's the intro to our podcast.
Yeah, I think, not to just so I don't, reiterate the exact same things. I think one of the things for me is that I think that there are so many people that if they don't get an opportunity to lead their fullest life because of the chronic disease states they've ended up finding themselves burdened by, right? And with so many preventable health issues that I've seen, I've seen firsthand, one, how much it can be kind of like handcuffs to have these.
It's honestly very sad to see. There was actually a patient, sorry to go off on a quick tangent, but there was a patient that had a stroke. I was doing my neurology rotation, and there was a patient that came in with a stroke, and he had literally retired the week before and was getting ready to go on a around the world trip. Yeah. He was literally about to go on an around the world trip and then got a stroke, and now everything's out the window.
Yep. So, almost the ability to live life to the full potential, I think to not be hindered by your physical state is what I would say. So preventive medicine is about not being hindered by your physical state in a lot of ways.
And I think the idea we're trying to put out there is more so that life is what matters, and it's not about health is not the end goal. We're not trying to get healthy just for the sake of being healthy, because that's what you see a lot of times on Instagram. You're like, get a six pack. Okay. Yeah, exactly. Why? What is that? What is the significance of that?
Like, hey, these eating this way will make you healthier. And then most of us like, what? Why?
Exactly. So our idea is not to get healthy, although that's the foundation of everything we're saying. Our idea is that we want you to live life like how you want to live it and have nothing like to stop you from doing that. That's what health is for.
Being healthy is like base camp, dude. Going off this the mountain climbing. It's
exactly
like that. It gives you that platform of like, hey, I'm 75, but I want to go water skiing for the first time.
Exactly. Why not?
You took care of all, you're taking care of your health. So you're strong, you're resilient. You don't have any reason why you can't do that. You can take up gymnastics at age 85. You can run your first ultra marathon. You can, and we're saying older ages obviously here, but like any age, you're 35, you have 3 kids. Why not run an ultra marathon? Why not take up powerlifting? Why not, go out and live your life in a way that brings you joy?
This is what I was talking about. I called Jason about recording this podcast earlier, and I said there were some dogs that yapped around in our backyard. They're out now.
We have some unwanted guests on the podcast right now. They really want to get on the pod.
Yeah, I think going along with what Jason was saying with doing what it is you want to do, I think one of the things that I incorporate into my life, kinds of a test of that, is I just want to be able to do random things. So if someone's like, yo, you want to go run? I'm not a runner by any means of the word, but if someone's like, you want to go run? I'm like, sure, why not? Let's see what happens.
And one of the things that kind of inspires me, and though it's not a message that necessarily, is maybe beneficial to a lot of people, but when I see people doing extreme stuff like running 100 miles or, like the David Gogginses of the world,
exactly.
They're doing all these crazy physical feats. Like, I'm like, why not me? If it's something that I value, right? But like, just as valuable as someone being able to pick up their grandson or their granddaughter or, living and not having anything hold them back.
Exactly.
So I think, one of the biggest things we definitely want to push is 1, how to be healthy, and 2, why it matters. And that being healthy is not the goal. Being healthy so that you can live is the goal.
Exactly. And I think we have a wide variety of guests as well that bring a lot of perspectives into that, because like we're saying, health isn't like, there's not just one thing into it. Like getting a 6-pack does not mean you're healthy. I mean, it's certainly a good indicator that you have like a low body fat, whatever. There's that, but there's so many different perspectives onto health and how you can,
mental side of it.
Exactly. There's that episode with Dr. Patel, which is I think it's an incredibly valuable episode that not many people can talk about, because I guess not many people live a preventive lifestyle mental health wise.
And I mean, I also think that, like you said, it's, shout out to Dr. Baraki for teaching us about the anti-reductionist thinking thought process. But, just to not be reductionist in our thinking about preventive medicine, there are so many different ways where you could call something preventive medicine, or even this idea of health that we talk about is being able to adapt and thrive. It's living and thriving, not just existing.
And I think that's the big difference between our podcast and a lot of the other like fitness ones that are out there in that space, because they're just talking about kind of how to get healthy. We're talking about number 1, how to get healthy, and then building off of that on what you're going to do with your health and like why that matters to be healthy.
And then, so if you ran into me at a coffee shop and I asked you,
here we go.
Dude,
we're flipping the tables now.
This is 10 years down the road. Dr. Sharma, how do I get healthy? Dude, your podcast is so great. How do I get healthy? 2 minutes.
So if you haven't listened to any of our other podcasts, hopefully you have, then at the end of every episode, we ask our guests in 2 minutes how to get healthy. And that's kind of a way to, I'm filibustering right now.
You're trying to think of your 2 minutes.
But yeah, at the end of every episode, sorry, just word salad that.
But before you even answer, I'll give you some more time to think just by cutting you off. But
I'm trying to give them context, man.
I think one of the things that in this question that I find fascinating is the different answers we get.
Oh, yeah.
Because literally every single guest is an expert, and they still all have some different avenue of the way they view preventive medicine.
Exactly. Yeah. And the idea behind this is to give like a quick digestible tip. So here's my 2 minutes. We're done with the filibuster. My thing would be to kind of just start somewhere and understand that you are not going to be perfect on day 1 that you start. It's okay to mess up. It's okay to take the wrong approach, quote unquote. You don't have to do hours and hours and hours of research before you even start doing any single thing. Just pick something, do it well, and then build on that. So whether that's just simply walking literally 5 minutes a day, if it's more than what you were doing, or whether that's drinking 1 less soda per week, just do something, but don't get complacent with that one thing and say, just because I'm doing this one thing, I'm healthy. it's always a process. Let it build. So for both Jason and I, we both started doing obviously incorrect things with our view of health, but we improved, we learned what we were doing, and then we kept going, building on from there. And now here we are.
Yeah, I agree with that. I think, avoiding a perfectionist mindset when it comes to health is so big, because there may be things that we practice in our own lives right now that maybe 5 or 10 years down the road, we look back on it.
Like, what were we doing?
Yeah, right. So it's not the idea of perfection, but the idea of improvement, right? So if I were answering that question, someone comes up to me, 2 minutes, how do I get healthy? I would say, what do you want to accomplish? Once you answer that question, then the other answers become more easy to fill in. But, what are some things that you would like to do with your life that right now you can't, or maybe 10 years from now you won't be able to, and why? And so I think my 2 minutes is going to be spent more of having them do some sort of introspective thinking of
giving them homework. Classic.
Yeah. Right. That trading roles.
Definitely being mentored by Austin right there.
But, what are some things you would like to accomplish that you feel like you can't, or things you're worried about in the future that you may not be able to experience? So, and once you answer those questions, check out our podcast.
Yeah, exactly. And that's where we start. And we want to thank you guys for listening to this episode. We hope you got something out of it. Hope you learned a little bit more about why we decided to start the podcast, a little bit more about me and Jason. And yeah, thank you guys for listening. We appreciate it.
All right. Thank you guys for tuning in.
Make sure to check out all of our social media platforms at Prevent Podcast on Instagram and Twitter. Make sure to check out our website, thepreventivemedicinepodcast.com.
And a very special thank you to every guest that we've had on for our first season. We couldn't have done this without you guys. So we look forward to working with most of you again, and all of you again in the future. And thank you for helping us get this thing started.
Yep. Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.